This is the future of breast augmentation by Dr. Chitty. Breast augmentation via breast implant bazooka. There you go. I know with the Motiva implants coming in, and all of us know that Motiva has been around for a while. They're new to the US, but they're not new to the world. But I think what a lot of people don't know is that we didn't get everything that Motiva has to offer, right? Motiva is bringing in certain products, but certain products are being left outside of the US. And those will likely be added to the line relatively soon. And what I'm talking about most specifically is the Ergo 2. So they have their standard round implant. They have the ergonomics, which has a more kind of slightly fluid gel, which allows it to move more naturally. But they also have the Ergo 2, which is incredibly stretchy. Now, one of the joys of having such a stretchy implant is that you can put them through a really small incision. And plastic surgery has flirted with this idea of like a minimally invasive, local only breast augmentation. And that was something that did exist in the past and then vanished because of good reason. And I find it very interesting that that future, which we thought was the future in the past, may be coming back to us. And maybe this will be the time that we get it right. But the idea of like the minimally invasive breast augmentation, I mean, in your opinion, do you think that if this is something that really pans out, do you think this is the future of breast augmentation? I mean, you've done as many breast augs as anybody our age that I know of. I mean, do you think that this is the future, or do you feel like it's going to come and go like it did?
100%. I actually gave a talk yesterday at the American Brazilian Aesthetic meeting up in Park City about my Motiva experience in the first 3 months. So we were the first practice in Utah to offer Motiva, the round and the ergonomics that are FDA approved, like you mentioned. And my first case was October 22nd, 2024. I've done 35 cases in that time frame of Motiva implants, and that was about half the cases of total breast implants I did during that time. So I looked at my data, I looked at the styles I was using, like what are the trends, and I kind of report all that data in this talk. But we talked about this, and one thing I talked about is all these cases I did were all what we call subfascial or prepectoral, above the muscle cases. And I've been doing them with the bra, internal bra, and scaffolding. But I really think all of this is headed towards what you're talking about, where it's like minimal downtime, smallest incision possible, right? Not scarring the breast, preserving as much breast structure as possible. They talk about this breast preservation, this Joyda, the Preserve, whatever you want to call it, that's out there in the world that is being used. These devices that allow the Ergonomics 2 gel that you're mentioning, which these gels are, like you said, they're very viscoelastic, they call it, but they're also very cohesive. So they're going to hold their shape in memory, but they're going to be able to move with your body and stretch. So like I said, they can put it through almost like a bazooka gun through your armpit into your breast while you're awake because you're numbed up. I mean, I think the technology is fascinating, and I think it will actually open the market for women who probably at this point didn't want breast implants. I think there will be more and more women who potentially will want it. Again, I'm not speaking for women, I'm not a woman, but looking at Motiva's market research and what they've done in other countries, they know that that is definitely an appeal to women, and it can maybe reach women who currently aren't interested in implants. And so I think, yes, definitely Motiva 6th generation gel, there's kind of the main things that are different from the current 5th generation that we have in the US. They have their smooth silk technology shell, which I think we've talked about in a previous podcast. But really, I mean, they did the study with MIT showing that 4 micron surface just does not have an immune response from the body on it. Your body doesn't want to attack it. So, the whole thought of capsular contracture forming is very low. And their 4-year FDA data, it's less than 0.5% over almost 500 patients in their study. So very low rates of capsular contracture even at 4 years. And so all these things I think are advancing us, right? Because a lot of what we did, I think, in the past up till now was done because we were trying to prevent things like capsular contracture or hide a really crappy implant. Now we're like, let's just throw it in the breast tissue. Let's preserve all the breast ligaments. And we were so confident in our product because we made it so well that you're not going to see rippling. You're not going to see the edges of the implant. You're going to look like you have a natural breast. It's going to feel natural. And you're going to have pretty much no downtime getting this done.
There you go. This is The Future of Breast Augmentation by Dr. Chitty. Breast augmentation via breast implant bazooka. There you go.
Yes.
I mean, it kind of looks like a bazooka, right?
Yeah.
I saw pictures of the product, but basically it's using vacuum to suck the implant in. But there's certainly challenges that are associated with that. And my question is, and we'll talk about this, I think, a little bit more next time we've got a little bit more time to talk about it, is are the issues of the past with minimally invasive breast augmentation, are they truly fixed with the new system?
Yes.
And I guess we'll find out.
Sorry. I gave it away. I'm sorry, I'm very biased, but yes. I mean, nothing's perfect, right? At the end of the day, I think, and I tell patients, all my patients, like, there is no perfect surgery. Otherwise, we would just do that every time, right? So I think there's so many nuances in what we do in plastic surgery. I think it's part of the art of it is, talking to a patient, what are their needs? What are their wants? What's their anatomy? What are their limitations? What are our limitations in terms of tools or technical ability and our knowledge, right? And you bring that all together and then you say, okay, you actually probably are a better under the muscle or dual plane candidate, or for whatever reasons, or you're a better subfascial candidate. But I think having all those tools in your tool belt and then having that ability to analyze the problem and help them synthesize a solution, like that's where I think it differentiates surgeons that are maybe, going above and beyond or exceptional versus ones that are doing the status quo, right? And it's fine to have everything in between because, you don't need to be either or all of the above. But I think you want to find the patients that are drawn to you that want that, or some maybe just want, hey, I want traditional augmentation. I hear that all the time. And so I think it's teasing out, okay, why is it that you want that? And it's okay, but let's figure it out why. And a lot of times it's like, well, my friend told me I needed that. Okay. Right. And so you talk to them about the limitations of each, and it's still their decision. But I think making them fully informed is the most important thing. And then you come up with a solution for them.
Yeah. Well, you can't just have one solution for everybody, right? It's like everybody's going to be different. Some people have different goals than other people. The important thing is that you have all of the tools in your tool belt to be able to get the type of result depending on what they are after.
Yeah, totally.
The breast implant bazooka. Motiva should coin that. Trademarked.
I think they probably have. I'm sure probably one of their trademarks. I saw when I went down to Costa Rica back in July of last year, we went down to Suleon, which is where they have this really high tech. It's where their plants is. It's where all the implants are made. But they actually have an operating room, kind of like that Grey's Anatomy style, where it's like glass above and you're watching. And they did live surgery for us, and they had their surgeons there in Costa Rica that had patients come in, and they did the bazooka, they call it the MIA, but the minimally invasive approach. But yeah, it was a really, really cool technique. And the patient's like awake. They were like sedated. And, they numb it, put tumescent in there, put the numbing solution, and bazooka it up.
Yeah. But it's like, it's something that we used to do. It's like transaxillary incisions and the tuba procedure. I mean, these things, we've had forays into this in the past. The question is, what makes this different? And I feel like the technology for the implant hopefully is going to be the difference maker. Only time will tell.
What I would love, and I've talked about this before, and I'm not the first person to talk about it for sure, but it's something I'm very obsessed with, is we create, as surgeons and as a community of plastic surgeons, techniques for women. We think about rhinoplasty, preservation surgery, right? Like preservation rhinoplasty. I think, and they talk about breast preservation with Motiva quite a bit, and that's something they talk about when we went down there. Let's talk about preserving ligaments and preserving the muscle and preserving the skin. All these things, even preserving the skin on the breast. That's why they're trying to go through the armpit, because you're not actually cutting the breast; you're cutting into the armpit. But if we could come with techniques where we're doing that and we're adding potentially like internal bra support through those small incisions, I mean, to me, that's a game changer.